Hi, it's Dr. Cohen. It is May 1st, 2020. What I thought we would do today is talk about testing. This is Billy Trujillo. Billy is from a beautiful company called Microgen, which has both the antigen tests and the antibody tests. What's great to know about is we're going to be testing our patients prior to surgery, making sure they're safe. Our goal as we read back and get open, Jamie's here next to me, my office manager. Come say hi, she'll be helping us. Our goal is that people are safe with our surgeries. We're gonna do an antibody test on myself right now. So he's got an antibody test and we're gonna show it to you. Tell me about this. The antibodies are developed after you have, God forbid, an infection of the vaccine, of the COVID-19.
Correct. So you have antibodies called IgM and IgG.
Correct.
With your initial immune response will be carried with the IgM, and so then from there, when you build up the antibody, you'll develop the IgG positive antibody. So we're here to test to see if Doc has ever been exposed to COVID-19.
So it's like a pregnancy test. Hopefully I won't be pregnant. Well, they're going to prick my little finger.
Yeah. As she's working, go ahead. You can prick.
Oh.
I'll just add a few things.
You better not hurt me.
I'll just make sure
The antibody test is from Vita Testing. It's not a Microgen product, so I just want to be clear.
That hurts.
Just want to be clear with that. So it's a Vita Testing product, and it's distributed by Viva Medical.
That hurt.
Well, there's not much coming out.
Because you hurt me.
Oh, man.
So she's using a pipette to get my blood.
It's not going to be a lot, but...
Ow.
Can I do drops and then drop it and then
drop it
again?
in. And she's
Not
dropping
gonna
it
be
into the... Come on. Here, I'll go this way.
She might need another poke.
Yeah, you're not a bleeder. Get some.
Put it in the well. There you go.
One drop. Let me poke. I'm going to poke you again.
As long as it's covered.
I don't want to be poked twice. Oh,
Because you don't
shit.
drink enough water.
Ow.
Payback.
That'll work. That'll work.
See, he needs to drink
There
more
you go.
water.
You do. Less coffee, more water.
Okay, you got some blood. That's enough. You're not getting any more blood.
You get
from me.
one more poke.
No way, man.
Yes, man. See, it's wanting to...
Wait, just squeeze the blood out.
No, because you wanted a clean plate. You want a clean plate.
How much blood do you need for an antibody test, Billy?
More than what you're giving.
Yeah, three drops of blood in the well.
Okay, that's one. Here's two. Come on,
wanna
get
come
it in the
out.
well.
Well, she doesn't want to come out.
Shake it. So we're trying to get blood out of my finger and putting it into the
You don't
well.
have any blood.
Yep, this baby's not.
Hang on, there it goes. Joe, maybe you can angle the...
Impatient
Maybe
over
you can
here.
angle the phone so people can see the blood going in, you know?
Have you ever heard doctors are impatient?
Come on, get the blood out of there. It doesn't have to be sterile, just blood. Should we use a different finger, maybe? There you
There's
go.
another one. I think we need one more.
No, there you go. Look, she's got almost 3. That's 3, I'm telling you. That's 3 drops of blood. Ow.
You know, this is when you take off steri strips for patients.
There we go.
This is the same thing.
Can you shake your pipette and get that blood out?
It's
So you
going
might be able to suck
inside.
it back out when you do the serum.
What do you mean do this serum?
Oh, that's right.
There we go.
Oh, you missed.
No, it's in the well.
Yeah, got it. Perfect.
Good?
Yep.
Okay.
So show it to the camera.
All right.
Show the serum to the camera.
So we put my blood right there to do an antibody test to check IgM and IgG antibodies. Now, if I'm going to go operate, I don't really want an antibody test. I want an antigen test. I want the saliva test that this company has. Because, I mean, you want both, really. It'd be nice to have both. But if someone's going to have an operation, we're going to start with the antigen test. The antigen is the saliva test. It's a PCR test for COVID-19. And we send it off to Lubbock, Texas. It comes out within 48 hours. And we could either send it to your house, right? We could
Yep.
send it to their house.
Yeah, we can.
And you could spin into a little bottle. We send it off Lubbock, Texas, and you get an answer within 48 hours whether you have it. After we test you, which would be 4 or 5 days before surgery, you have to shelter at home. because I don't want you out shopping or meeting other people, and then we're going to do your tummy tuck or breast augmentation. So you got to get your saliva tests, shelter at home, don't be around new people, and then we'll operate. And again, that's for asymptomatic people. If you want to know whether you've been exposed, then an antibody test, like the one I just took, should tell us within 15 minutes. Is that what we're doing?
Yep, you need to put the solution on there, three drops.
On
Three
the blood?
drops.
Yep, the same well,
Okay.
same well as blood. And that
Jeez.
activates it.
Okay, well, will you angle it again so people can see that, Billy?
Oh,
You
here,
could-
I can come up.
So we're going to
Make sure you
activate
get
my...
part. That's the most important part. So make it,
We're going to put the solution
3 to
on
4
there.
drops.
1, 2, 3, 4. Good.
Perfect.
So that's Cohen blood
Working
and
its magic.
solution. And in 15 minutes, we'll know if I have antibodies to COVID-19. Is this test, talk to us about are you allowed to talk about
Yeah.
sensitivity and specificity? Because we hear that antibody tests aren't that good, that it's not very sensitive or specific. So talk to us about
Right,
that.
the Vita testing product is developed and manufactured in China, and it's submitted for EUA, and it is 96.3% specificity and 100% sensitivity to the COVID-19 test. So it's only testing for COVID-19.
Okay. We don't know.
It's very effective. I actually had COVID back in late February, and I've taken about 50 of these. I've taken about 50 of these tests, and I've come out positive every time. So I definitely believe in the test. I think it's serves a purpose.
I'm staying 6 feet away from this guy.
So I'm actually carrying the antibody. That's what you want. You want to carry the IgG positive. You want to be there, and that's the point. Everybody
Your
wants to get back to it.
IgM comes up first when you first get the disease, and then goes down, and then IgG antibody then comes up.
Correct.
So if you're negative with IgM but positive with IgG, that means that you are protected against the COVID-19. But for how long, we don't know.
We don't know. There's a lot we don't know about this virus, but that is correct.
If you're positive for M and positive for IgG, that means you are
currently infected
currently infected
or reinfected,
or reinfected, and we're not going to be operating on you.
Right.
You need to shelter at home.
Correct.
If you're negative for IgM and negative for IgG, it means that you haven't been exposed,
Correct.
most likely, to the COVID-19.
Correct. Would you like to show them the control? See if this is an activated test. Is the control bar up?
Oh, yeah, that's right. Good. So you can see the control bar is up, what does that mean?
That means that it's an activated test and it's working properly.
There you go. It's working properly. Will it tell me if it's a boy or a girl? Or not?
Yeah.
That's
That's another test.
Sorry, just joking. If you have any questions, people are joining us right now. If you have any questions about antigen or antibody testing, please ask me. If I can see it, I'll try to answer.
You can go to our website at Microgen for the PCR test, confirmatory test at www.microgendx.com.
So here is the Microgen saliva test. So if you're coming for a pre-op, we're going to have you take 4 mouthfuls of spit, put it into this bottle, secure it back up. You then take this, put it into the bag like this, with a requisition like this. You put it into this box, and then it's going to get shipped by FedEx to Lubbock, Texas. And within 48 hours, we'll have an answer.
FedEx.
FedEx. We'll have an answer, and I think these are also FDA approved tests.
EUA, FDA approved.
Okay, EUA.
FDA approved. So
Okay. What does that mean for our staff?
that just means emergency use authorization. It's got to go through a process to even get that validation or that designation.
Okay.
And so
that's a little bit about testing. I don't want to wait and keep going till the answer is.
Right.
But I think what we'll do is we will show you the answer, okay? And we'll post it. I'll take a picture and post it on Instagram. All right, so thank you all for your help. If you have any other questions, please let us know. We're here in Southern California and Encino, as you know. We're hoping to start opening up. Beverly Hills did open for cosmetic procedures. We're hoping up the rest of LA will hopefully open up soon. We don't quite have all the answers yet, but I think things are moving. So we will let you know. Thank you very much for watching. I hope you all enjoyed me getting stuck for my antibody test, and we'll share you through the results. All right, take care. Thank you very much, Billy, for being here, by the way.
Thank you.
I appreciate that.
mhm.
I think that was helpful. I don't know how to turn it off though. Oh, end. And